1 in 5 Canadians suffer from the most pervasive health crisis of our time, metabolic syndrome. You may have heard about its 5 underlying conditions that lead to 43% of deaths in Canada each year. Family doctors can detect it early, and with the right support, reverse the risks. The Pacific Northwest Division of Family Practice is determined to eliminate metabolic syndrome and type 2 diabetes from our population. Every 3 minutes, another British Columbian is diagnosed with metabolic syndrome or type 2 diabetes, and while pharmaceuticals can manage symptoms, diet and exercise are the most effective treatment in avoiding catastrophic health events. The Change program works for all of the underlying conditions of metabolic syndrome simultaneously and reverses the damage before it's too late. Approximately 1.5 million people in BC have diabetes or pre-diabetes, and this number is expected to grow by 35% over the next 10 years. Diabetes contributes to 40% of heart attacks, 30% of strokes, 50% of kidney failure requiring dialysis, 70% of non-traumatic lower limb amputations, and is the leading cause of vision loss. Individuals continue to struggle with selecting programs they can trust to improve their health. Family physicians in the Pacific Northwest are leading the way in implementing the Change program in BC and reducing the incidence of metabolic syndrome and type 2 diabetes. Prescribing the program gives patients a dedicated team of medical, exercise, and nutrition experts in a customized evidence-based program. Regular assessments review medical, exercise, and nutritional progress so patients and their health team work together at improving health.
As a family physician, this program is extraordinary. It allows people to examine their lifestyle with an exercise therapist, a dietitian, and their family physician. It's customized for personal needs and lasts for a full year, supporting lifelong changes.
Change BC started when the Pacific Northwest family physicians observed about 40% of their patients had symptoms of metabolic syndrome or type 2 diabetes. After piloting the Change program in 2018, and with the spark of the Pacific Northwest innovation, the results were impressive. It continues to evolve as a grassroots initiative, with new community partners linked with top academic leaders and clinical experts from UBC and universities across Canada to provide the best supports to help people get healthier.
Change BC is inspiring. Bringing exercise and diet directly into primary care practice is transformative for health. It's a great model of team-based healthcare that brings together a group of dedicated professionals working with individuals to build stronger and more vibrant, healthy communities.
In terms of preventative healthcare, I don't think I've seen anything more inclusive in the Pacific Northwest in a culturally sensitive way in my entire career.
Indigenous communities have voiced that to improve the health and well-being of communities, we need to address and acknowledge the access to traditional foods and land-based physical activity. Traditional foods such as berries, salmon, seafood, seaweed, wild game, and wild greens are so good for our health, and the harvesting and gathering of these foods is equally as important.
What I think about the Change program that will work for First Nations community is bringing two culturals together to support the one common goal, and that is the health and wellness of everybody. How we get there is our journey. And what Change BC has to offer will empower First Nations communities and mainstream society alike.
What are our patients saying? 100% agree the Change program was relevant to them, helped them understand their health issues, and that seeing a dietitian and a kinesiologist along with their physician added value for them.
In addition to this, the team provide an ongoing support to patients to ensure that the treatment goals are achieved. Both the testimony from the patient and from the care providers are great. Likewise, the outcome of the program.
In a nutshell, as well as being invited and inviting, it's the personal contact. I really appreciated Dr. Odo, local physio people, and the young students who were there. And I also appreciated the weekly phone contact with the nutritionist.
The Pacific Northwest Division of Family Practice is delivering some of the best results we've seen across the country. They're innovative and resourceful, and their focus on making the Change program one of the building blocks of primary care in the province is exactly what our communities need. No gimmicks, no fads, and no profits.
I was one of the initial physicians involved in the Change BC program in northern BC. I loved the Change BC program because I saw it give my patients a sense of control and power over their diseases.
Help us make the Change program available for all of BC. To implement the program in your family practice or see if the program is available in your community, go to the website changebc.net.